Hello, everyone. I'm Betty Cruz with the World Affairs Council of Pittsburgh, and today I'm joined by Divya Nawale. Divya is a climate activist currently based in India, and she currently works with Asian Development Bank on clean energy and energy programs across Southeast Asia. But today we are speaking about the state of the COVID-19 pandemic on the ground in India, where Divya lives. Divya, thank you for joining me today for this conversation. You're currently in India, where the second wave of COVID-19 infections show no signs of slowing down as the country's overwhelmed healthcare system faces supply shortages for hospital beds, oxygen, medicine, and vaccines. Additionally, the World Health Organization has reported that 1 in every 3 new coronavirus cases globally is being reported in India. Welcome. Can you please tell us what is the state of the virus? Is what you're seeing on the ground, and how did it get so bad so quickly?
Thank you, Betty. I'm really grateful for this opportunity, and I think it's a very pivotal time, especially because of the fact that India has just crossed the 20 million cases mark in the last couple of days, and so that's overall cases, and we crossed Brazil, and technically we're just behind the U.S. in the total number of COVID cases since the pandemic began early last year. And the reason why this is a major blow to the country is because of the fact that how fast it went. I think typically COVID curve, or like we've heard the term flatten the COVID curve a lot, and the curves always look something like this, like there's a peak and then it throws. But basically what happened in the case of India is the cases kept going and then went down again in sometime end of 2020. But if you look at how the curve has changed in India, it's basically just shot upward in a matter of a couple weeks. And I think one of the reasons that happened is because of new variants that came in, and it's also driven by the fact that the central government had, allowed for certain activities to go on to the normal phase. Without trying to be political in any way, I do want to mention that there was a religious event that was held a few weeks ago, which I think, of course, is important to our country people, but also could have been something that had, been kind of organized better. And also, we had the cricket tournament, the Indian Premier League, take off during the same time. And although all restrictions were being followed, I think what was not anticipated was that there were a few variants that had come in. Of course, I think they were identified that these were similar to the variants that came out in the UK and South Africa over the last 6 months. However, I think a lack of understanding of how fast these variants could spread if they came in a developing country like India is what was underestimated. I am myself recovering from COVID-19 at this point. I've already tested negative on my second test just 4 days ago. Although I do not have any symptoms anymore, I'm still in the recovery phase with a lot of fatigue that I face on a daily basis. I definitely think that it was not just about the lack of awareness of people who started thinking that, okay, looks like like COVID has a kind of left its grip altogether, but also driven by a lack of real leadership in the country. And what has happened in the last few weeks, as we have seen around the country, more and more people were struggling with the healthcare system, is because whatever funds came in were not judiciously used, and it is not clear why we were not equipped for a system that could really handle something like this. It just showed that there were a lot of loopholes, and that we were never ready for this kind of a pandemic in the first place at all. We were just lucky that we skipped the first wave around the world, where a lot more cases were happening in, say, Brazil, UK, and the US. And Of course, a lot of people came up with ideas that Indians have stronger immunity against the virus, and there were, I think, even the BBC came out with an article which said that why is India not affected as much by the pandemic at that point. And they talked about everything from yoga to also like the Indian spices, which build strong immunity. And yeah, there is definitely substantial proof that these all work. But what we did not anticipate was that the virus would mutate this way. Based on a different population, I think the virus is capable of of being more fatal. So I think what's more important, and what I think should be learned, is that uh, we need to kind of be aware that this could happen anywhere else in the world as well. And I think it also drives us a lesson. Say if the next outbreak is elsewhere in the world. So, but having said that, I think the Indian government could have done much better. I
Well,
think
and the prime minister is being widely criticized for these super spreader events, for this mismanagement, as you've pointed out. I also want to share with the audience that you're here today as a citizen, sharing your perspective on the ground.
Mhm.
Obviously, your expertise is in climate change, so you have obviously also understanding of the systemic impact. But you are here sharing as a citizen on the ground what you're reporting. But as you said, what we're seeing in India, it's there are lessons there for other parts of the world, and we're seeing that also in Brazil, and we're seeing that also in Colombia, where the uprisings
Mhm.
that are being reported as well, just as early as this morning, are the
Right.
residents are desperate for what's happening again, mismanagement of vaccines, of funds.
Yes.
Um, can you share more about where you specifically are in your region, and again your day-to-day experience? Because another thing that we're hearing, right, that we're seeing reports of, are how the system in India is on the brink of collapse, the healthcare system, how the hospitals are being crammed with so many patients that train cars have been forced to convert into
Mhm.
COVID-19
Yeah.
isolation wards.
Yeah.
And, parks and parking lots are being converted to makeshift crematories. So can you please say more about those dire circumstances?
Yeah, absolutely. I think what has happened is that the um, the the citizens mainly were kept unaware of the fact that something like this could happen again. And I think the messaging had completely moved towards the whole vaccination situation. And what just happened is that once the vaccination drive started, a lot more people started relaxing and thinking that, okay, so the vaccine has come out, and right now, like, only people above the age of 60 are getting it. But it
Mm.
also means that there is no possibility of this getting any worse. So we did kind of we were in a space where like my both parents are fully vaccinated now. And having said that, I know a lot of people, especially who have got their parents vaccinated. But the fact remains that a lot of things had opened up everywhere, and life was going almost back to normal, with restrictions, with like certain measures in place. And I think that was what caught us off guard, especially young people. What I've really seen in this time, and what I'm hearing differently from 2020, is that a lot more younger people like me have been impacted. Nobody above the age of 18 is safe. I know people who have got COVID a second time because their immunity was compromised because of already having been affected with COVID from the first wave.
Mm.
And I've heard people struggling for resources. And now coming to that issue, what has happened is, in general, the Indian healthcare system is very more mainly privatized, and so it's a kind of a like divide that comes into play in such situations more starkly, where obviously the people who have access to some resources like contact information of hospitals as well as money get more easy access. And so really the people who are suffering in this pandemic are the people who are in the rural areas where there's less healthcare access, and also people who are not able to afford a bed in the hospital, which is like really expensive right now. And I think I'm not even going to mention numbers because the range is very wide. In different parts of the country, beds have become ICU beds have become so expensive, ventilator support has become expensive, oxygen cylinders are being sold like at like 20, 30 times their price. And all this has happened because the government did not prepare for a second wave. It's simply having said that. So when the WHO has obviously announced that the pandemic is going to go for a while, and the fact that what we've learned from 1920 pandemic or the 1820 pandemics is that it takes a few years for the pandemic to truly go out. And so I think we've not learned our lesson here, and the healthcare system did not back up itself in time to really act on a situation like this. And of course, it was uh, not as expected, it was unexpected. But the fact remains that at the end of the day, the government is responsible to act for its citizens in such dire situations. It needs to address any gaps that there are in the system, especially when we are aware that a pandemic is ongoing across the world and raging everywhere, one after the other.
Mhm.
And so I think what I've seen different, and what really is has been the most inspiring thing that has happened, is to see normal citizens jump into the whole situation and actually come together in different ways to support each other. So everywhere on my Instagram and Facebook and social media, uh, you can see 100 requests every day, people trying to help somebody get an ICU bed or just be able to get them to a hospital, or simply even if you're self-isolated, living by yourself, to have food made and delivered to you.
Wow.
um, and this is something that young people, especially in India, are doing. As you know, India has one of the fastest young growing population in the world, and I think to that effect, I think the young people are really showing up, and they are being there for each other,
That's that's
and,
wonderful.
and
So inspiring.
yes,
Please continue.
yes, and I can vouch this because like I mean my own undergrad university alumni association, we have formed a COVID support group, and it has 250 active volunteers who are dealing with cases every day, and we have divided them across the north, south, east, west regions within the country. And we have totally kind of responded to around 400 requests, and these are wide, from blood donation, plasma donation, to oxygen cylinder, to ICU beds, to getting somebody to a hospital. Everything that is medical request is basically, it's being driven by young people, young graduates who probably have in the age group of 20 to 35. This is the driving kind of uh, age group that is really making a difference. I have had friends check in on me every single day when I was self-isolated. I had a COVID home care package, so we have virtual packages, so we can consult with doctors online, and essentially, it's more convenient because obviously you don't want to risk going to a hospital in a situation like this. So I had a COVID virtual recovery package with a doctor, and she was amazing. She always ensured that I have a diary tracking all my symptoms and all my kind of uh, O2 levels, like my oxygen levels and temperature and everything, every 2 hours, and ensure that I'm getting my medication on time as well. And I think
You should do
so. Even
more
young.
Can you share more on where you are in India? So for folks that are tuning in, we've talked about the disparity with the rural
Yeah,
communities. India is a huge country. Can you share, provide
right.
a little bit more context on where you are? And are these services, are these home healthcare packages something that is seen across urban areas across the country, or is it
Yeah.
more regional?
So I'm in Hyderabad, which is considered, I think, the fifth or sixth largest urban population in the country, behind the four metros. And I would say that, I mean, it's one of the top five cities in the country. So for me, ease of resources and access to resources is much better. And I think the COVID virtual packages have been like launched very recently. It wasn't the case last year. There were not many people who were looking at these kind of services before, because there was just no not as many cases. And so it really was a need of the hour. And these are young doctors mainly, who are very tech savvy, who have jumped onto this and said that, like, if we can't help these people who are staying indoors, then they are the ones who will end up in the hospitals. So, and I think that's very important, right, to be able to ensure that the people who are isolating at home get that support. So because if they don't, then they might end up another another place where they could have been saved in the first place. So, and like I said, it's the young people who are being impacted so badly at this
So it's
point in
wonderful to hear how the young people are taking action and how young innovative doctors are also seeing the wave as it's coming and how to put in interventions as early as possible, like this home health care and many the lessons that obviously are there for the rest of the world. But there's also been an expectation, rightfully so, that public health experts have demanded that the global community, particularly the United States, step up to address the country's vaccine shortfalls, among other resources. Can you say more on what you know, your community, what you're hearing as what are the thoughts on what the global community's role in slowing the spread of the virus in India should be?
I think so far the global community has responded very well. Um, and I believe we have oxygen cylinders coming from Singapore and Germany, and the US has released a lot of raw material for the vaccine preparation. As you know, vaccines are manufactured. I mean, India is the manufacturing hub for vaccines. So definitely, I think what we need is, you know, like massive support right now in terms of like pharmaceutical equipment, and that's been coming. But I think what the news is telling me, and as far as I am aware, based on what I'm hearing, is that all these resources are coming, but they're not being distributed um, in an equitable manner, and that is the bigger concern now. And so I think what the governments and countries that are sending aid right now should be looking at is to ensure that it's actually being distributed equitably on the ground, and it's actually reaching the people who are in dire need. And I think that's something that they can do as well, because of course they are sending in all these equipment and all these resources. So that's something that I think every young person in India would vouch for, that this is what we need right now. And at the end of the day, I think we would all be really worried about the vaccination drive that's happening for the people between the 18 to 45 years of age. That includes me. And because what has happened is people above the age of 60 were given vaccines, which was basically handled by the government. But now again, it's moving towards like, private actors coming in, and they will be able to just like, provide the vaccine at various cost. And I think that's again something that we really need to be concerned about. And I think we might even run out of vaccines, because India is a country of more than 1.3 billion at this point. And so we have to be clear that all of us need to get the vaccine. It can't be that we run out of vaccines in the next 1 to 2 months, and then there's like 60 to 70% of the population that has still not received it. So that's really important. And so I think those are really valid points that different countries can also kind of chip in and kind of drives in their own way, because they're providing so much aid and resources.
So speaking to these resources, you've talked about how communities around the world are mobilizing, are showing support, are stepping up. Can you say more about what are some specific resources as we close out the conversation? Information on how individuals can help support India, can even as far as helping with that more equitable distribution on the ground to citizens during the crisis. How can we help?
So at this point, I think, I mean, if there are people out here listening and just really wanting to help people directly, I think they can join a lot of other celebrities, for a lack of a better word, like most people from abroad are being able to use a particular platform called Give India. I have been a Give India donor for more than 2-3 years now. And I mean, I donate to various causes on Give India and I trust them completely. And what I've seen is that everyone from Jay Shetty to Priyanka Chopra to everyone has been using Give India as a wider platform to be able to, because there are a number of fundraisers within that. So I think anybody who's able to donate from abroad is able to go on it and be able to choose what cause or whichever um, uh, kind of project that they would like to support. There's everything from like food support to medical supplies. So it's possible to kind of see where your funding is going. And another thing that I wanted to share is that having been a part of the Pittsburgh community, I have a lot of connections there even now. And I know a lot of people are using Give India to be able to contribute towards, especially the South Asian dance community where I know people. They have been a very kind of kind and supporting through the Give India platform as well. So I can vouch for that. And more than anything, I have had friends from all over the world from my Pittsburgh network. I mean, wherever they are, they have been reaching out and checking in on me. So I'm really grateful for the fact that, having lived in America, I know that, they're always there for me.
Excellent. Once a Pittsburgher, always a Pittsburgher.
Yeah.
Thank you so much, Divya, for joining me today, for joining us today to talk about this incredibly important topic. We're going to be sharing resources, Give India, as well as other links so that folks are aware and can take action, which is most needed right now. Thank you again so much. Until next time.
Thank you, Betty.